Okay. Please go ahead and thank your colleagues for what I'm sure was rich and challenging conversation. So may I just see the show of hands for the reporters so we can quickly make this happen? I'd love for us to kind of report what some of the key takeaways were. And after we've kind of gone around with that, to hear a little bit of your thoughts in terms of the sectors, what you do, under what conditions, and what are the potential co-benefits. So we'll start out with the takeaways and then kind of hear a little bit of the work that came out of the tables. If the reporters are brave enough to just identify themselves, I'll come to you and we can do this pretty quickly. Oh, okay, thank you. To start with, and then so we can hear as a whole.
Okay, so the real challenge is, can I read my handwriting? Okay, takeaways. We found it intriguing and also challenging that in education and criminal justice, they can take bold action with limited evidence, which it would be much harder to do in health. The co-benefit concept was also intriguing. For example, in the energy sector, and how it can benefit other sectors such as health. Okay, give me 1 second. Oh, there were potential opportunities, I think this is yours, potential opportunities for health to support other sectors by reframing their issues as health issues, by helping to articulate how health is affected by the issues that they're working on. Also, the possibility of identifying financing models from other sectors. Okay. One interesting point that was made here was that one person's efficiency can be another person's top line, so that investments in public health are viewed as costs rather than investments. And this is the hardest one to read. If health supported other sectors' objectives such as childhood education, anti-poverty, reduction in incarceration, housing quality, this will have health benefits so that we in public health can support other sectors in their work, whether or not those efforts are explicitly viewed as health interventions.
Thank you, sir. Are there any questions from either of the other two groups? Anything you heard that you're not quite sure if you understood it? All right, who's your spokesperson here? Excuse me, Margaret.
Thank you. We had a little bit of a thread, so that's kind of always nice to just hear. So a couple of takeaways I'll pick out. One is that several of us found it inspiring in the Georgia example that even in a place in what would seem like very difficult political environment, that example was able to succeed. So that was an inspiration and a little bit of a surprise for some. And then we talked about, we shared some observations about how several of these examples might be limited in their generalizability to population health because they were actually very individually oriented interventions. So the justice examples were about kind of reinvesting in individual and family level care as opposed to kind of community level criminal justice issues. Maybe the moving to opportunity is a little bit like that as well because it was about individual families as opposed to, so they might be a little bit more analogous to risk factor based prevention than they are to the more general population health. That is the goal of this roundtable. We also did some reflecting to what you were just saying about co-benefits and health and other sectors because we were very excited to hear that many of these examples were measuring health outcomes, but there are very few health institutions or programs that offer to hold themselves accountable for their outcomes. So we don't hold our health clinics and hospitals accountable for educational outcomes or housing outcomes or jobs outcomes. So if we're really committed to co-benefits, we're gonna have to be willing to have that sort of mutual contribution to impact for their outcomes as well as ours. And then we had two lenses to add to the typology. One was to think about both operating expenses and capital expenses, observing that public health has very little capital expense. And then the other one was that it might be nice to have how much potential there is for it to work in a multi-sector lens. So maybe some of our ideas will help us think about that. So some might be more suited to single sector or just bilaterals versus broader multilateral ones. Those were top level things.
Thank you. Thank you very much. Any questions there? If not, your spokesperson here, Bobby.
So our conversation had similar echoes in noticing that there were some noteworthy similarities and differences across these sectors. These stories all sort of cut through what otherwise is a predicament that a lot of the population health colleagues face when it becomes hard when you're dealing with all these multiple causal factors to decide where to start, and that can lead to a kind of paralysis. And so what we saw here were examples of beginning first with a menu of options, and then places that had at least a claim to solid evidence and a relatively short yield that you could get something going, is a kind of liberating condition that otherwise is hard for people who want to cover the entire space of all these multiple drivers of population health. We also, I'm trying to figure out what's most noteworthy here. Our conversation sort of turned to the time horizon for planning, and that, if you look at budgets from year to year, next year's budget is only a slight variation of last year's budget. But the more you look out and ask from a sort of an investment mentality, if we start investing differently now, can it put us in a different path? And that opens up much longer time horizon kinds of things, and even openness to partnerships that may not have been part of the past, but actually can be a means of delivering greater value into the future. What else? I'm not trying to repeat. I don't want to repeat the ones that are similar that we also named. There was this whole theme about how to be much more specific about anticipating and calculating these co-benefits. I guess that's a version of what you were just saying. I think, without duplicating, those are really the highlights. Anybody else want to say more about what we'll get to the second round of this in a minute, right? Anything else? No? Going.
All right, thank you all. So I had a question about co-benefits. We've used the term quite a bit today. Do we have a common understanding about what that is? When you think of co-benefits, is it that we benefit independently or together? So in my mind, I'm just thinking, when we did the chart, there was, if you had two people working together, you derive some benefit, I derive some benefit, we're co-benefiting. Or is there something that is shared in common that is the co-benefit to both? And I just wasn't sure if there was any kind of thought about what that is or was, or if you had any conversation about that.
We didn't talk about it, but I had a comment about it. I think from a population health perspective, everything we do is co-benefits. There's a co-benefit because the drivers of population health are all from other sectors, and the implications of improving public health have positive benefits for the other sectors. So if you have a healthier population, you have a healthier workforce, which means you have more workers who can generate more revenue to, so on and so forth. So when I think of co-benefits, I just think of it as simply a byproduct of population health.
Any other reaction? Yes.
I think when people utilize health and all policies approach to analyze a problem, one of the parts of the analysis is to look at who gets benefits and what portion of benefit do they get, which, again, I think goes back to population health using that kind of an approach. It's premised on the fact that it won't be a single entity or sector that will benefit, but in fact it is multi-sectoral in both its effort and its benefits.
Another way that people talk about co-benefits is a mutual win-win. And I think that if there is a co-benefit, I think it's a much stronger, if you are doing something where the benefits are coming from another sector, and you're in a much stronger way to propel them forward.
What gives the question salience is the fact that culturally we divide areas of expertise and knowledge into buckets, as well as funds flows and revenue flows. And in other cultures, say over in Europe, some of these things are reorganized differently, and therefore these questions don't have as much salience, to get back to the Bradley issue. So therefore, when we're talking about it here for our purpose of promoting population health improvement in the U.S., then it becomes relevant about whose benefit from a historical or cultural standpoint, so that can inform actions or beliefs or attitudes that could change, that might open up possibilities. That's the way I think about it.
Is it then, I think I'm loud enough. Is it then just a... I think that's it, folks.
Yeah.
So for the sake of the web. So the question is, my question to follow up, I guess it's really both of you. Is Cobenefit really more a communication device or a framing device that one might use in a policy setting to help, bring more political support? Is that really what it's about, or is there more to it than that? I mean, because co-benefit, if we take a population perspective that says that any benefit that occurs in virtually any of these other sectors is going to have a health impact, right? And that also that the health impact will have a benefit to other sectors as well, then is it really a matter of just framing it in a way that people can see that there's a relationship where health would benefit as well as education or criminal justice or whatever your area is?
I know it might appear that the conversation is happening mostly at this table because the microphone. but feel free to weigh in.
I would say there's another co-benefit that is beyond just messaging or communication, that there would actually be tangible dollars, and whether that's because it's generated by a tax or whether it's generated by waste reduction, and how we would negotiate how the sectors would share in that benefit to be invested in other approaches would need to be discussed. But I think we should have it more than just co-benefit because we're lending our voice. There should be times where there's actually money that we're generating that can be reinvested to finance population health.
Would you add to that, or that pretty much? Great. And I didn't mean to necessarily go off track a little bit, but when we talk about fiscal fluency, in my mind, I'm just thinking to be fluent in the language, you should be saying the same thing that the person you're speaking to is actually hearing and understanding. And so being clear about what that is will probably be important. All right, so let's shift our attention to what you came up with. And we recognize this was de novo, this was, the world has just been created, you have the opportunity to say what you want to happen and it will happen, and it probably won't necessarily happen like this, but give us an opportunity to start to try on bits and pieces of what we heard today. So I'll start with this table and then wend our way around. And I'd ask you do what Bobby did, which is if you heard something, you just go ditto or very close to that and then share something else. Thank you.
Okay, we had a few solution pathways, but I won't report them all. I'm just going to say we were very productive, even if I don't tell you everything we did. So one that we talked about for a while was inspired by thinking about the use of social costs in the energy policy conversation, and then also about the reinvestment model. So we kind of were putting those two things together. And we're going to use education and health to illustrate this, but it's not that it would necessarily be specific to those two sectors. But we talked about undertaking some kind of mutual regulation impact assessment so that the sectors would agree to approach that process together. So for example, if there's a requirement that schools do needs assessment, they would include health in their needs assessments, and the community health needs assessments would include education outcomes in their scope. and that the conditions under which that would have to happen is that there would be mutual agreement and reciprocity around how assessments are done, accountability, and then how the decisions are made with what to do with whatever that might yield. Our hope is that this would potentially yield either co-reinvestment opportunities because of avoided costs or savings, depending on who your audience is, or even just new investment opportunities. You'll realize where you might have interventions that you might want to both invest in because you can see so much more clearly that they would benefit both of you. So this idea of doing your impact assessment there. Other conditions that we talked about being necessary for that would be developing the trust between the sides and also the inclusiveness that we were talking about earlier, so that you're also doing this in a way that is inclusive of the community that you are trying to benefit. The other one I'll pick to talk about, because it links to one of our takeaways. I think also I would add that in our co-benefits, we were always also talking about how you almost have to have the co-benefits conversation internally as well, because hospital systems think of population health as a very different thing than public health people do. So you have to think about their patient population versus the broader population. The other one we talked about was just trying to push these justice reinvestment programs to take a slightly less individual and broader lens, and are there ways that if the community benefits in those communities participated with them, perhaps some of that could be a joint investment in things like violence prevention, community policing, behavioral health, so ways that there might be a co-investment there across those two sectors. And to also bring the broader population community level thinking to those justice things that are happening, which would yield, greater safety, which would lead to all kinds of stress-related health benefits. You can all imagine the co-benefits. I'll leave it to your imaginations.
Are there questions? No? All right. Sure.
So, is what you're saying that the reciprocal of health in all policies ought to be implied, where whatever we do in health is, say, energy in all of our policies, criminal justice in all of our policies, and so on?
All policies and all policies.
So how does that work? What's the limit on that?
Yeah.
I think that you would have to agree some kind of reasonable limit, because right now the dialogue feels a little bit like we're asking them to do health pact assessments in almost an unlimited way, and we're not offering anything, so that doesn't sound like a very good bargain. But I suspect in your mutually reciprocal, inclusive, trusting relationship, you could come up with some reasonable limits.
Would you give priority to certain sectors in that formulation, and how would you give priority?
So that was actually where I was going to go.
Well, that's probably the $1 million question, or the however many total dollars you have question. But I think you'd have to mutually agree on your priorities. Like, you can't come in as the health sector and say these have to be the priorities, or as whichever other sector and say these. That would have to be part of the process, I guess. Yes, yeah, a consensus. Second best. I'm trying to think of all the words we use to compromise. Yeah.
I was thinking about it a little differently, George. I was thinking about it depends on what you want to do, what the evidence shows the impact of that is. So let's say you're trying to get investment in social emotional learning programs in schools. You know what I mean? You would have the limit around academic outcomes, health outcomes, maybe some education, employment outcomes as well. So I was thinking of it coming at it more, what were you trying to fund, and what does the evidence show that that particular intervention impacts? And so the scope would be determined around that.
I was thinking that you might say, well, you'd have to include on the list energy impacts. Whatever you think the list ought to be, but so it's still from the health point of view, not necessarily from a mutual point of view.
So this sounds like maybe a discussion that continues on in terms of how you actually make that happen, or if you make that happen. So let's go to this table, hear a little bit about what you guys came up with.
We did work out a few sketchy examples, but it's worth noting, or at least we observed, that there are stories that have come to the foreground even through this roundtable that, if revisited, are actually stories of multi-sector investment. We weren't really critiquing them that way or examining them for what they have to say about co-benefit or the conditions in which multiple parties ended up taking actions that actually were perceived as in their respective benefits. And so if we're serious about understanding how sectors, plural sectors, can actually alter the conditions and lead to sort of different investment philosophy, then and a task might be to go back through the roster of past examples, even just within the roundtable, and select those that might be the more poignant stories. Did I get that right?
And that's also, that was really meant also in the spirit of giving communities choice, because people have already existing relationships, traction, and you have a menu, and we just didn't look at it, I think, in a number of workshops through this particular lens when we were talking about it over time.
Just the other piece of homework is that while we are inventing a few examples here for illustration, the new Tifa Blueprint has a number of examples of multi-sector sort of local health improvement collaboratives that are beginning to identify some of the conditions when their financing could be more pooled. And did you want to say anything more about that one, Vina?
No, I think that's it. The blueprint was released this morning. We'll get a link out to send it to everyone. But yeah, we did pretty much exactly that, of pulling through our collective knowledge of examples from previous conferences, meetings, and talking to folks really across the country to pull out those examples of multi-sector work that's happening, both strategically, finance-wise, and a few that have outcomes to demonstrate, which we talked about, how that's sort of the holy grail, and they're few and far between that can really show demonstrable outcomes, but that's obviously the goal. So yeah, thank you.
So lest you think we pitched our entire exercise and just pointed to other documents, we worked through a few. The first one has to do with sort of the role of business organizations or even economic development corporations that have choices to make about where to go and how to be corporate actors in a particular region. And the co-benefits around this have to do with attracting and retaining talent and decreasing their own costs. But some of the conditions that allow this to happen are partly an ethic of shared responsibility, but also a recognition that there are certain costs of doing business in a region that can be figured into sort of corporate budgeting and can yield some pretty significant investments that I don't know that all the other sectors or governmental organizations see the business as expecting to have a certain kind of cost of doing business in a region. And as in this era when we're talking about anchor institutions and how a shared economy can be built, this is a different lens. And I don't know if you want to say anything more about that.
You did a great job.
Anyway, so that was one. We had others.
All right, thank you, sir. All right, any questions there? Otherwise, I'll turn it over to Tom.
Okay, so you probably can imagine this table. We talked about a lot of things. And I think I've been able to piece together two things that respond to the exercise that we're doing. So the first is the use of sin taxes, such as sugar-sweetened beverages, cigarettes, alcohol, which would have the benefit of reducing obesity, but also reducing healthcare costs because of reduction in cancer, heart disease, and other conditions. Using those taxes to invest in lead-free water and clean water, physical education in schools, and after-school programs for physical education, which would have the co-benefits of improving health and also improving educational outcomes. The other idea we had was to establish a for-profit company where selling bottled water or some other product that would not be, we have to figure out what to do with the plastic bottles. Save that for later. Okay. Glass bottles, recyclable glass bottles. The profits from the company would all go into equity-based, evidence-based public health interventions. Under the conditions of we would have a sustainable model for supporting public health interventions, and this would improve health outcomes and also create jobs.
All right, so I recognize it's almost 5, and so we're probably getting to that place where our brains are feeling like they're completely drained. There's one question that we have in terms of completing the poll, but what I'll probably do is just ask, while Colin brings that up, if Pamela and Sani could close us out. I just want to say how much I enjoyed being in the presence of really learned, smart, wise, and bright folks. And I made a ton of notes that I think would be helpful to the work that I do personally at the local level. And I think there is an opportunity here, based on what we've heard today, to continue the conversation with some of these sectors in a way that makes sense. So that we can, in just about every example, the health benefit was almost like collateral. It wasn't necessarily the intention, but it was derived. And so is there a way in which we can platform that, or think about how, when we're talking about financing, to start seeing the sectors as partners in making this happen? And so I look forward to what will come out of this group in terms of instruction for those of us who are on the ground in making things happen. Thank you so much for this opportunity as I turn it over to Pamela.